Hi everyone, and welcome to today's device cast, Collagen Induction Therapy with the eDermaStamp. My name is Elise. In today's device cast, we're going to be covering what is Collagen Induction Therapy, or CIT? How does the eDermaStamp work? What can we treat with the eDermaStamp? Why your device choice matters. The eDermaStamp difference, and treating with confidence. So what is collagen induction therapy? Collagen induction therapy, or CIT, also known as microneedling, involves repetitively puncturing the skin using sterilized microneedles to induce the natural wound healing response and achieve skin rejuvenation. CIT is typically performed with either an oscillating pen or a roller device. It can be performed at various depths depending on the desired outcome of the treatment. So you may have seen that needles can range in size from 0.25 millimeters up to 2.5 millimeters. CIT is a relatively affordable and minimally invasive treatment that offers results for a variety of skin concerns. How does the eDermaStamp work? Let's talk first about the effect on the epidermis. Microneedles only puncture the skin rather than ablate or remove the epidermis, which is commonly seen in laser resurfacing. Therefore, most of the epidermis is preserved with microneedle treatment. This allows for rapid healing and for a lower risk of infection. As microneedle wounds are small, healing of the epidermis takes place within just a few hours. Now getting deeper down into the skin, into the dermis. Microneedles stimulate the production of growth factors in the dermis. These support the repair of damaged skin and promote the formation of new collagen and elastin. Pigment-producing cells of the dermis remain undamaged. This means that treatment can be safely performed on darker skin types when used in conjunction with home care. Microneedling enables the repair of blood vessels and capillaries, which means treatment is suitable for rosacea skins. In the mechanism of action, the needles penetrate the epidermis and down into the dermis, causing the skin to become damaged. Collagen is then produced to aid in the wound healing process. The injury becomes smaller over time, and the result of the wound healing process increases the amount of collagen and elastin in the skin, leading to a rejuvenated skin. Microneedling process relies heavily on wound healing. The skin naturally heals rapidly to restore barrier function post-injury. There are 4 consecutive stages of wound healing. The first one, hemostasis. Second, inflammation. Third, proliferation. And fourth, maturation. So let's have a look at these processes a little bit more. In hemostasis, this is the first stage of wound healing. It occurs immediately after microneedles have penetrated the skin, and the function of hemostasis is to control bleeding. Blood cells will recognize that the skin has been injured and form a sticky plug at the site of the wound. Long strands of tough protein then form a mesh-like structure to form a clot at the site of the injury and prevent blood loss. Without this process, wound healing would not be possible and any minor wound would just bleed out. Our second stage is inflammation, and this starts shortly after microneedling and can last from 3 to 5 days post-treatment. During inflammation, blood vessels will become larger to allow for an increase of blood flow to the area, bringing oxygen and nutrients. It also brings immune cells to help to remove debris, kill microorganisms, and start the development of new blood vessels in the area. These immune cells will cause swelling, heat, redness, and pain, all of which are normal side effects of treatment. Inflammation is a normal and vital process in wound healing and should be expected when performing microneedling treatments. Stage 3 is proliferation, and in this stage, new collagen and elastin are deposited in the skin. New blood vessels form to facilitate healthy tissue and brings oxygen and nutrients to the site. And our final stage is maturation. Maturation involves tissue remodeling. Collagen fibers form strong bonds and become well organized in the skin. Microneedling wounds heal by first intention healing, which means little to no tissue loss. Therefore, in the maturation phase, we have no formation of granulation tissue and therefore no scarring of the skin. So what can we treat with the eDermaStamp? Indications for treatment include scarring, static right hides and laxity, striae distensae or stretch marks, pigmentation, sun damage, rosacea, enlarged pores or uneven skin texture, and transepidermal drug delivery. Let's start out with scarring. The thickness, width, and depth of hypertrophic, contracture, and atrophic scars can be addressed with the eDermaStamp. We see an improvement in the appearance of the scar along with relaxation of the tissue, which is especially important when it comes to contracture scars, which can feel quite tight. A combination of treatments can be used to enhance the clinical outcome of scars. So for example, if the scars are red in colour, we may use IPL to reduce that redness alongside microneedling to improve the texture of the scar. Static right hides and laxity. The eDermaStamp will combat the effects of photoaging and chronological aging. We can improve firmness and reduce the appearance of fine lines, wrinkles, and a loss of elasticity in the skin. Improvements occur by thickening of the epidermis and the dermis. One study in particular found a 40% thickening of the epidermis 1 year after 1 to 4 microneedling treatments, showing that the results are long-term. Striae distensae or stretch marks. Striae are linear atrophic depressions of the skin that occur within the dermis. Striae show reduced fibroblast metabolism and reduced levels of collagen and elastin. The collagen induction therapy treatments will address the scar tissue, the lack of pigmentation, and also help to increase the tensile strength of the tissue by inducing collagen and elastin synthesis. Next is pigmentation disorders, including post-inflammatory hyperpigmentation and melasma. Unlike light-based treatments, the eDermaStamp treatments will remove the risk of heat injury, which minimizes the risk of hyper and hypopigmentation. We help to improve the communication between pigment-producing cells and skin cells, which allows us to achieve a more even distribution of pigmentation within the skin. Collagen induction therapy is a suitable procedure for patients affected by melasma and for clients who are prone to hyperpigmentation. We can also target pigmentation caused by sun damage, including age spots, solar lentigines, dry skin, and oxidative stress. Our superficial needling treatments target the epidermis, and this allows for transepidermal delivery of antioxidants in order to reduce oxidative stress caused by UV exposure. We increase the bioavailability of nutrients and antioxidants, stimulate immune cells to the treatment area, we achieve a thickening of the epidermis via the release of epidermal growth factors. And we also achieve exfoliation of damaged keratinocytes via increased cellular turnover and epithelialization. We can also treat rosacea-prone skin, including couperose skin, broken capillaries, and diffuse redness. Rosacea clients are rarely suitable for many clinical procedures because they have a fragile, sensitive skin. However, our eDermaStamp will break down old and damaged blood vessels, stimulate healing and strengthening of the skin and of the vessels themselves. Treatments will help to promote thickening of the skin, to help to reduce sensitivity, and to decrease the appearance of skin redness. Enlarged pores and uneven texture can be effectively treated with the eDermaStamp. Pores are stretched to allow for an excess production of sebum or oil and also perspiration to pass through, and this results in the appearance of enlarged pores. This can occur due to age, particularly puberty, genetics, comedones in the skin, and if improper extractions are performed, damaging the skin. The eDermaStamp treatments will lead to reorganization of old collagen and promote elastin production. This will minimize the appearance of enlarged pores and dramatically improve skin texture. Transepidermal drug delivery. eDermaStamp treatments will allow for the penetration of larger molecules in active ingredients. Through treatment, we can increase product absorption by up to 80%. Botanical vitamins, minerals, and peptides can be delivered deeper into the skin, and this deeper penetration into the dermis can enhance the results of our topical products. Products can be tailored to suit and target all skin conditions. So why does your device choice matter? Well, not all devices are created equal. There are a multitude of in-clinic and at-home devices available for purchase, but it's important to take into consideration several factors before purchase. First, is the device manufactured by a reputable company that prioritizes safety and ease of use? Next, is the device a rolling device, or is it a motorized, vertically penetrating pen? What type of needles are used, and does it use disposable cartridges? Is the depth of penetration and treatment speed adjustable? And are the in-clinic treatments complemented by a specialized home care system? Well, let's have a look at the eDermaStamp difference. The eDermaStamp is manufactured by Dermaroller GmbH, which was founded in Germany in 1999. They have a certified quality management system and is approved by the EU Medical Devices Directive. Products are created for dermatologists and plastic surgeons. Dermaroller was awarded the Aesthetic Awards Treatment of the Year winner in consecutive years, along with the Pinel Award for Best Product Innovation. This device is TGA listed, and Dermaroller develops complementary products for use with the device, along with an effective home care system for clients to enhance and maintain their results. Let's have a look at a traditional Dermaroller versus the eDermaStamp. With a Dermaroller, we only have one needle depth. The needles cannot be adjusted, so the depth that you choose is what you will be treating on the entire face. The treatment is user dependent because it depends on how much pressure, how fast you're moving, and a number of other factors. The dermal roller is difficult to maneuver around small and curved areas due to the barrel-shaped roller. This device is difficult to penetrate into scar tissue due to its mechanism of action. We achieve more epidermal damage, more bleeding and a more painful treatment, and it does have a high consumable cost because these dermal rollers are single use only and the entire device is to be disposed of after every client. We see in the image that when treating with a dermal roller, the way that the needles penetrate the skin form a triangular shape. This means more epidermal damage, which leads to more bleeding and therefore more painful for our client. If we have a look at our eDermaStamp, we have an adjustable depth and speed of treatment. So we can treat scarring on the jaw, and then we can treat for product penetration on the forehead. It's easy to maneuver around the face due to the pen-like structure. It vertically penetrates into the skin, which means that it can treat scar tissue easily. And we can see in the image, rather than having triangles in the skin of damage, it's a single column, which means we get less epidermal damage, less pain, less bleeding, and a low consumable cost because it's simply the needle cartridge that is disposed of after each treatment. The pen itself is kept. So how does the eDermaStamp compare? The eDermaStamp consists of high-speed motorized treatment head that vertically penetrates the epidermis and dermis. It is an ergonomic device that uses disposable needle cartridges and has an adjustable depth of up to 1.5 millimeters, which is suitable for treating all skin types and conditions. Needles are depressed inside the cartridge, which means that needle stick injury is far less likely than with a dermal roller. As the cartridges are disposable, the DermaStamp is more economical than your traditional rolling method. Maneuverability of the pen minimizes the potential for uneven application, even between different therapists, and it has a flexible speed operation. Additionally, the eDermaStamp uses precision cone-shaped microneedles that adhere to rigid European regulations, and you can see a clear difference in the image between a derma roller needle compared to an imitation needle. These needles will gently displace the skin rather than aggressively puncture the skin, which helps to reduce side effects and minimize downtime for our clients. This results in an atraumatic micro wound that seals after minutes of treatment. Other knife-shaped needles require increased pressure in order to slice through the tissue, which means treatment is more painful and we risk unnecessary trauma to the skin. A patent spring seals the needle tip from the handpiece to avoid the handpiece becoming contaminated or soiled by body fluids. The eDermaStamp uses the optimal number of needles in order to maximize effectiveness with less force and trauma. Devices that have additional needles will compromise the safety and comfort of the treatment. If we think of it like a bed of nails, which can easily support a body weight without penetrating the skin, as opposed to a single nail that would easily penetrate the skin. The fewer number of needles, the more penetration we're able to easily achieve. The vibrating effect of the eDermaStamp helps to increase procedural comfort. Unlike other methods of needling, the oscillating motor feature dissipates nerve receptors, allowing for a less painful and more comfortable treatment. The body will recognize the vibration of the device as opposed to the pain that it causes. Dermaroller have also developed a range of tailored home care products for use with the eDermaStamp, along with a specialized home care routine. This will complement and enhance results for our clients. These products include a hyaluronic acid and vitamin C serum for skin hydration and brightening, a CC color correcting cream which contains snail slime which has anti-aging properties, masks that can be used immediately post-treatment, a hyaluronic acid serum, hyaluronic acid ampules, a skin cleanser, a lipopeptide which is great for anti-aging properties, a moisturizer that contains vitamin A, C, and E, and a home care roller that can be used by clients to help to accelerate and maintain their results post-treatment. The clinical outcome of our eDermaStamp treatments include short-term pinpoint bleeding, which often stops completely before the client leaves the clinic. Swelling and erythema is expected up to 72 hours post-treatment due to the inflammatory phase of the wound healing process. Clients often feel a heat sensation, mild discomfort, petechiae or bleeding under the skin for up to a few days or weeks, and they may experience mild microcrusting. The improvements from an eDermaStamp treatment can be seen as little as days after the treatment and can continue to be seen 3 months to a year post-treatment. We see improvements in skin texture, tone, colour, and tightness. And we also get an overall improvement of the original treated concern. Here we have an incredible before and after relating to acne scars and post-inflammatory hyperpigmentation. Next, we have a before and after from one single treatment of the eDermaStamp. We see clear improvements in the skin tone and texture. Next is another amazing result for acne scarring on the skin. Along with improvements in the scarring, again we see improvements in skin tone and texture. Here we see the powerful anti-aging results that the eDermaStamp can achieve. We see lines and wrinkles in the forehead dramatically reduced or disappeared entirely. And next we have the results from eDermaStamp treatment on traumatic wounds on the head, reduction in the appearance of redness of the skin, and improvements in hyperpigmentation. Now let's talk about boosting results and revenue. The great thing about being able to increase results for your clients is that it also allows you to generate more revenue for your business. For every client, we recommend performing a skin analysis. This is best done with a skin imaging system such as the Observe 520, which will allow you to take photos to accurately assess pigmentation, redness, anti-aging, and acne. By taking photos throughout your treatments, you can allow your client to see the incredible results that you have achieved, which will encourage them to trust you and also allow them to adhere more strictly to their recommended treatment plan. Product sales are essential because a healthy skin will heal better and get better results. We also recommend combining your eDermaStamp treatment with additional services, including microdermabrasion and hydrodermabrasion, IPL, chemical peels, LED, oxyfacials, Botox and dermal fillers, Q-switch rejuvenation, carbon facials, sonophoresis, microcurrent, and radiofrequency. The best element of the eDermaStamp is that at the Global Beauty Group, we want you to treat with confidence. Our expert clinical team provides in-depth training on the eDermaStamp theory and practical application to ensure that you can confidently provide safe and effective treatments to all clients. Training will ensure your confidence in the eDermaStamp through performing thorough consultations, the wound healing process, treating various skin concerns, choosing your needle depth, identifying contraindications, and combining with additional treatments. Plus, you will receive ongoing support from the entire Global Beauty Group team, including our marketing team, our service engineers, and our clinical team. Thank you so much for joining me for today's device cast. And if you would like to experience the eDermaStamp difference in your business, please don't hesitate to reach out to one of our friendly account managers. And if you would like to contact us, please don't hesitate to reach out at the following phone numbers, email address, or at our website.